Namaskar.
Just to let you know, today obviously is 14th of November, and this is also the Diabetes Day, where Dr. Banting invented his date of birth is 14th of November. He invented the insulin, and also today Janamdin Jawaharlal Nehru ji ka, also Prince Charles, and also happens to be my wife's birthday as well. Sunita ji ka birthday bhi aa jaye. So I just let pass the information. But and let's Dr. Kapur ji, you can take over now. You can start. Thank you very much. Om, good morning to you. Namaste. Jai Durga ji. Jai Durga.
Namaskar. Good morning. Om. सर्वप्रथम हैप्पी बर्थडे टू सुनीता जी. तुम जियो हजारों साल, साल के दिन हो 50,000. महारानी से मेरी यही प्रार्थना है, आपको और शक्ति प्रदान करें और आप अपना काम करती जाएं और हम लोगों को गाइड करती जाएं. थैंक यू वेरी मच. लवली डे देन. तो पार्टी के लिए तैयार हो जाना. फिर अभी पार्टी. आइए सीधा बैठिए. नेक स्ट्रेट, स्पाइन स्ट्रेट, शोल्डर बिहाइंड. मन सहज, आंखें बंद. ध्यान मुद्रा में बैठ के लंबा गहरा सांस लेंगे नाक से और मुंह से 3 बार पवित्र नाम ओम का उच्चारण करेंगे. ओम भूर्भुवः स्वः तत्सवितुर्वरेण्यं भर्गो देवस्य धीमहि धियो यो न प्रचोदयात्. ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःख भाग् भवेत्. ओम शांति शांति शांति. Let's all pray to Almighty for the universe wellness. Everybody should be healthy, wealthy, enjoy prosperity. Nobody should suffer from any ailment, whether that is physical, mental, spiritual, social, emotional. With these good thoughts, we'll start our session of yoga. Now, keeping in mind all the precautions. We all know yoga is very simple, very innocent, harmless. But again, there are certain conditions in which we should be very, very careful. And the yoga is tailored according to your physical and mental condition. So like suffering from hypertension, or even for low blood pressure, heart problem, severe acidity, severe asthma, severe backache, please do it slowly. Follow your own body. And if you're going to do poses, bending forward, please don't bend forward if you're suffering from hypertension or even low blood pressure. Any movement with a low blood pressure create problem. You get dizziness. And then if you've got backache, heart problem, and here I'm talking about osteopenia and osteoporosis, because we are at such a golden age where our bones are disappearing, getting so fragile. There's no bone mass, muscle is disappeared. So we have to be very careful. Osteoporosis is quite common, more common in the woman than in the man. 1 in 3 women after the age of 40 are suffering from osteopenia or osteoporosis, and the man 1 in 5. There you are. So one has to keep in mind, the session is done according to your participant who are sitting in front of you. As my sessions are all senior citizens, the young ones, they are all recycled teenagers. So one has to be very careful. So don't bend forward if there is hypertension, low blood pressure, heart problem, osteopenia, osteoporosis, backache. And when you're going back, again, if there's a big hernia or hiatus hernia or acid reflux, that creates a lot of problem and not uncommon. And other thing is, you've got any gastric problem or any problem in the intestine, for example, like gastric ulcer, peptic ulcer, or severe hyperacidity or colitis even. One more condition I will come back in detail, which is not that common, but once it happens, it can be life-threatening. Diverticulitis. Diverticulitis. That is your inner lining of your intestine goes out like hernia, you know. Some people are suffering, and if you are not diagnosed in time, it can perforate and you can die. So one has to be very careful. So these are the things one has to keep in mind, and first and foremost is empty stomach, whatever you're doing. And other thing is follow your own body. Just follow, because our body is our mentor, guru. Guru ki आज्ञा मानी, सब कुछ ठीक रहेगा. So let's start. Various ways you can start. Today we are doing chair exercises, which is quite ideal for us. Why we are doing chair exercises? Because of our age, plus maybe we are having so many disabilities also. So there is no excuse not to do yoga practice. You have to do in every condition. Whether you are healthy or you are ill or you are young, you are old, you are small, you are big, you are fat, you are thin, you are a male or a female, or you are poor or rich. No part to yoga practice, provided you do with full surrender, Sharnagati. Then full concentration when you are doing it. Dhyan Purvak Yoga. That's what Swamiji is saying all the time. And then comes follow the technique and timings, and most important is your sankalp. Thinking positive. I am going to do it. I'm going to get better every second of yoga. I am getting better. I am healthy. I am strong. I am beautiful. I love myself. That's what Swamiji taught us. So there we are. We will start. You can start either way, either from upper part of the body or from the lower limbs. So let's start from the upper part. Now, whatever exercise we do of the arms and the upper part, that gives help to our chest. Chest also expand with that. Other thing is always keep in mind, breathing in, breathing out, coming up, breathe in, going down, breathe down. So this is very important. That means pranayama is going on throughout, whatever we are doing. That is our base, आधार, जिसके ऊपर हमारा जीवन है अब. Pranayama. And the pranayama is first and foremost. Try to spend a lot of time on pranayama. There's no need to do any strenuous exercises. Do gentle exercise, little bit jogging if your body allows you, and go on breathing, doing various steps of pranayama, spending more time depending upon your condition on Bhadrika, number 1, and then Kapalbhati, and then comes Anlom Vilom and Ujjayi. This covers us. Now, at this age, what we are suffering? There are 3 dosha in the body, Pitta, Kapha, and Kapha. At this stage, we are suffering Vata problems. That is giving up joint pains anywhere. We are getting cramps, so many cramps we are getting. And our Jataragni is going down, with the age, that is getting weak and weak and weak. So that will be lifted up. That is all Vata problems. And other problem is our cough and cold. Old man is always coughing. That's what the children say, why didn't you go and see that doctor? You are coughing all the time. So we are coughing, having sinusitis, blocked nose, and respiratory problems like bronchitis. And how many people die in winter, even in this country, from pneumonia? Why they are giving us flu jab? That is the reason. People spoke when the COVID came 19. They were talking that the death rate will be like 20,000 people, as every year these people die of flu. And look at the number now, COVID-19. So these are the 2 major problems which we are suffering at this age. And as I said, we tailor our steps of yoga according to our physical and mental conditions. So let's start with soft, gentle exercises. Again, I won't be covering everything because I want to concentrate on various other things also. How to activate myself. I am feeling there's a difference, Some days you are so active, full of beans, and some days your body is so stiff. So what to do? And we are anxious also. Other problem at the moment is, since the COVID has come, so many people are dying. The people we know, people we don't know. So we get into that stage of anxiety, depression, stress. So what to do? Very easy. Do tapping. And if you look at the social media, they are full of tapping steps. Different people give different advice. We follow very simple. So make a fist and start from here. I want to activate first myself, and then I can go on doing other things. When you're doing this, go on breathing. Your Bhadrika started already. Go on breathing from the nostril, mouth is closed. Make sure your chest is expanding. Long deep breath. Carry on. I am activating my hypothalamus to take over my depression, anxiety. Very good. Carry on with a smile on the face. Come on. This is your crown chakra also. If you go on doing for a little bit longer time and closing eye and doing your meditation, chanting inside any mantra, Om Namo Bhagavate Vasudevaya. Soon you will be going in the state of Samadhi. Well done. Now come on your shoulder. This is covering your neck problems, the thyroid, parathyroid. Very good. Very good. Your body, carry on. So many problems, neck problem. Activating the nerves of the neck. Then come here. There's a crease here. You can see the crease. Do this. They say there are 1,000 diseases connected to this one. You can do first clapping to generate more heat. Clapping is sign of happiness also. Carry on. Then do this area. And if you can't do, you can do any part of your arm. Very good. Very good. Very good. Very good. This area. Very good. Very good. Very good. Very good. Now come here at the collarbone area. And your lung is also activating, as taught by our friend, Mr. Sarvat Pada. Go on. Good for the lungs also. Good for the heart. Come down here. Be gentle, this area. This is your thymus gland. Take away the anxiety, plus it produces T cells, which help us increase our immunity to fight against any invader, virus, bacteria. Do like this. The level is the heart area, you know. Or you can say from this dimple to sternum, midway. Now you have to be gentle here, you know. You are digging it in, but don't do bash like this. Why? This organ is very, very sensitive. Well done. Now come down. This is very good to increase the motility in your bowel, get rid of the constipation. You are doing your right side, your liver, the gallbladder underneath, left side, same level, your spleen, the blood formation. In the center is your pancreas, the troublemaker for diabetes. So do that. Activate your pancreas. Then go down. Do like this. Do like this. Then come down more. This is all reproductive system, you know. Your uterus, cervix, vagina, fallopian tubes, ovaries, to activate the ovaries. And in the male, the prostate and the testicles. Come on, hold it. Come on, carry on. Now do the back, the kidney area, adrenal area with a fist. Get rid of any backache also. Give a smile on the face. Come down more. Just to show you, I have to stand. Now this is the area. This is the area where the hemorrhoids are coming in the anal tract, anal fissure, anal fistula. And in the young woman, when she got this dysmenorrhea, painful period, this area should be done. Hemorrhoids are very common, especially at this age, because of the constipation. Next is your lower part of this one. Very good for the varicose veins. Take away the pain also, both the sides. Next is your clapping. Clapping and laughing. People suffering from snoring, they should always do laughter yoga, hasya yoga, and singasana to get rid of this snoring also. Puja Pranayama. Well done. You are quite activated, I think. I can't see you all, that's the problem. Yes? Are you activated? Give a good smile on the face then. Give a good smile. I am going to be very, very gentle because I love this age. The next one is very simple. We are all doing this. Very good for rheumatoid arthritis, pins and needles, pain. Go on breathing from the nostril, long deep breath. Breathe in, breathe out. Keep your arm at the shoulder level, stretch out your arms. But if there's any problem, follow your body. The next one is I want to improve my grip also. I am throwing away the things, breaking so many glasses. Do like this, pinching, pinch, pinch, pinching. Next thing is this, every organ is on these hands, and the feet. So do like this. You can do like this. You can do like this with the knuckles, or you can do like this. So you will be catching many, many organs of the body, your digestive system, then the mental problem, too much stress, anger, can't sleep, always edgy, fighting for no reasons, every, including the thumb. Other one also with the knuckles, if you can manage. What else is happening? Look how I'm keeping my arms. That is good for my shoulder also, my elbow. And I am rotating my wrist also. For the carpal tunnel, the tennis elbow, frozen shoulder even. One movement is giving so many benefits. Very good, very good. Carry on. Again, clap. You are doing your acupressure. Whole body is here. Whole body is here. And you can your feet also. Do your feet. Do your feet also as well. Do the feet. Feet also. Very good. Very good. Very good. Next one is again which you do every day. Everyone is doing. Breathe in. Breathe out. Breathe in. Breathe out. Do you at on your own pace? Then on the side, stretch. Stretch. Level is very important. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. Now rotate your shoulders. Very good for the neck, for the shoulder, for the arms. Forward and then backward. Always relax your shoulder first and then start. Come on. Breathe in and breathe out. And try to squeeze your abdominal muscle in also. Tone up those muscles also. Carry on. Carry on. Then next one is, I will do stretching because why I tape or a tea towel. The reason for that I will tell you. Now we want to increase our bone mass and the muscle. So a lot of stretching should be done. A lot of stretching. If you are especially suffering from osteopenia, try to do this. That is, your brittle bones are coming up, or it is diagnosed as osteoporosis. Try to do a lot of those exercises, stretching. So hold like this. Now here, why I'm using this? I want my arms are at the width of my shoulder. Because when we do like this, sometimes arms are here, sometimes there. So this control, hold it tight, tight. And bring it back. Breathe in. Good for the shoulder, for the upper arm. Stretch. This is stretch out. No, not same thing. You can take it up, down, up, down, up, down, up, down, up, down, up, down. The next is, I want to do more rotation of my shoulder joint, not to get frozen shoulder, which is much more common, the people suffering from diabetes. So hold it and go on doing this. Clockwise, anti-clockwise. Stretch. Other one. I am doing few times because of time, you know. You can do with your chutney, with a scarf, or any other thing. Next one is bow and arrow. Hold it at the one end and stretch. First I am doing halfway. My spine is straight, halfway. Stretch, 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 stretch. Then go on moving, come down, stretch, do at your own pace, stretch, 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 stretch. So easy. You can do with your dupatta or scarf or not the tea towel, you need bigger one then. Hold it for some time. Then release. Other side. Hold it one end, halfway. I'm just touching my elbow area now. Stretch, stretch, stretch. Go on breathing also. Pranayama is going on. Then move, stretch. Feel command. Stretch, stretch. See, both the sides is working. My right arm and the left one. Look at my left arm. Well done. Try to practice this. It's very, very simple. You know, you can do with a belt, which is little bit, you know, elastic. You know, you can push, 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 push. Same thing, you can take it at the back. You know, for the back, sit in the front of the chair and do like this. You're doing a massage also. So many things are happening. The neck problem. There's no one there to help me. I am helping myself. Neck problem. Doing a massage. Come down to the shoulder. Come down more. Thoracic region. Then coming to the lumbar region. I'm getting low backache also. So do like this. What is happening actually? What is the science behind it? Increasing my circulation. That oxygen is going to help. Blood works like endorphins, painkiller. Do like this. Same thing you can do in the front of your body. Hold it. Do like this. Again, this is good for your, look at your shoulder exercise. Go down. Slowly, slowly. I am doing fast because the time. Then do this. I am suffering a lot of constipation. You know, Swamiji is nowadays talking about patti treatment, patti, the belt, cold and the hot. There's so much new things are coming. When we were trained 15 years ago, those things were not much spoken. Now talking about bhatti and patti. Bhatti, that sort of anima. But better than animal. So that's what I am doing. This is activating my balls so that I get movement in my ball and I can open up my balls. So go on doing this. From the back also you can hold it tightly. Come on, come on. And then what else you can do if your body allows you, keeping in mind all the precautions. Breathe in, breathe out, and go down. Go down. Then you come up slowly, 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 slowly. Breathe in, breathe out, go down very slowly. And come up slowly. So these are some things you can use. Why I'm talking more about this? You know, as we are growing up, our muscle and bone mass is disappearing and we are shrinking and we are walking like this. Like this. Our height is gone down, kyphosis at the back. So how I can increase my muscle power and the bone mass? There's so many exercises you can do. Stretching I've shown. Next one is weightlifting. Again, here you have to consult your physician before doing weightlifting, especially if you've got any problem with your eyes. You always consult. And one is another very important topic I will come back later on, which I have discovered this last week. So we do weightlifting. You can do various ways. The food can, it is hardly 450 grams. Yes, because we are a starter, we can't have heavy one and there's no need to have heavy one at this age. You can have this or you can have water bottles, 2 liters, 1 liter to start off. And then there are dumbbells also, the dumbbells, which are not very heavy. These are dumbbells, they're not heavy. So how to do it? We are going to squeeze our muscle. Now we are doing our arms. Look, so many wrinkles. Fat is even disappear, muscle is disappear. Good sign of age. Be happy, be happy. So do like this. Squeeze. I am squeezing here. 1, 2. Again, keeping in mind your breathing. 3, 4, 5, 6, 7, 8. In the beginning, you can do 3, 4 times and increase. Okay, other one. There is a hormone in our muscle known as myokinase, which increase our immunity also. We can't go outside. I'm not talking about gym. Maybe if you give me chance, Mr. Sarwar, I will talk about comparing the gym with our classes. And we are inside, we can do this gentle exercise, weight lifting, stretching ourselves. See, now you have been doing for some time, let's say, then you can take it up, stretch. Breathe in from the nostril as you're going up. Come down, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, look what is happening to my shoulder. Prevention for frozen shoulder, which is so common at this age. People are going to have a replacement of their shoulder. Be gentle to yourself. You can use the can also if you want. So light. See? Do at your own pace. then you can do this. Why we are doing? These are muscles, you know, biceps and triceps. We want to increase their muscle power, the bone also. Gentle, very gentle. Do slowly in the beginning. Follow your own body. Enjoy every step. Give a smile on the face. So these are the things we are doing, you know, which is very, very important. While we are sitting, we can do so much, so much. Other you are doing every day, your nitric oxide, you know, sweating. Sweating is very important. Very important. We can do on the chair also. This is also going to increase my bone mass and the muscle. At your own pace. Some of you are very active. Then other exercise you can do simple. This one, nitric oxide production to kill these viruses, COVID-19, Delta and what not coming up. Then up, down, up, down. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Then on the side, where you have done already. Now here we want to do now, while sitting on the chair, you can do practically 90% of the poses even. Now let's concentrate on our back, which is giving a lot of problems. Tadasana while sitting. Breathe in. If you are suffering from hypertension or low blood pressure, please don't do standing Tadasana. Okay? Stretch. You can lift your heels also up while sitting. You are on 4 foot. Stretch. Stretch. This will increase our height in children. But again, you will get rid of that bending of your forward bending of your spine known as kyphosis. Stretch. 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 Then come down slowly. Once again, breathe. Take it from the side, stretch, come, join, here, up. What's happening to my arm? So much exercise, get rid of fat. Stand on your 4 foot while you're sitting on the chair. Heels are up, 2 inches away from the ground. You're doing your feet exercise also. So come down. Then feet are on the ground. Do the bending. Right bend. So many benefits. You are activating your internal organs also. The pancreas, liver, gallbladder, spleen, intestine. Go as far down you can go. Don't overdo it. Then breathe in, come up in the center, go other side, go down, 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 down. Well done. Now come up again, slowly. Now here I'm going to have, my body allows me to do more bending. So one arm is up and other one is going down. I am halfway to the ground. Go down more. My left arm is very close to my left ear. Go down, I'm touching the ground now. I am touching the ground now. Very good for the waistline. get more smart. Very good, very good, very good. Don't overdo it. See how much stress is coming here. And what's happening to these organs? They are also getting a little bit sort of massage. Then come up slowly. No jerks. Yoga is simple, sahaj. Other one, breathe in. Right arm is going up, close to my right ear. Left one is going down. You can hold even there if there's space on your chair. You can put your hand there, or put on the seat if your body doesn't allow you to go down too much. But if you are more fit, go down slowly. I am halfway first. Then I am touching the ground. See how much is bending occurring. And stay there for a short time. That is very important. These poses are done with giving them enough time. That's what I have learned recently. Don't do everything in rush because your muscles will get annoyed and get more pain. Give them time. Carry on. Then come up, breathing slowly, slowly. Well done. Again, you can do your shoulder exercise and massage your own knees. And many more you can do. Like we do Caesar one, like this. Every day we are doing this with our friend every day. That other one I will come on Bhadrika Pranayama, which we do, breathe in, breathe out, take the arms up and breathe out. Open the hands up there, bring them by rotating, like making a fist. Now this I learned from Art of Living, which is very helpful. Again, you go according to your own body. We do in three powers you can say, medium, soft, and fast. When I do the fast, observe my body, what is happening. See, breathe in, breathe out. Breathe in, breathe out. This is my slow pace. Go you according to your own system. So there is no excuse not to do it. We have to do it every day. No medium. The next one, watch me. This is not for everyone. See, what's happening? I'm touching my chest. So I'm increasing my lung power also by doing this. See, you know those mudra, na? As we are taught by our friend, this side, that side, upside. Same is, see, when you do like this. But please don't do it if your body don't allow you. This energizes you completely. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. You will start sweating. Again, keeping in mind all the precautions, please. We think we have done enough for the upper part. There's so much you can carry on. Now, we start from our feet. Feet are always ignored. They're the most important part of the body, but we ignore that. So what to do? First, jump on the ground. Very gentle. Very gentle. Very gentle. You're doing your acupressure also. All the organs are on the soul as they are in the hand. That is also a therapy. Very easy. Go on. You can do your arms also at the same time. Why not? Very good. This will take away my pain also. The next one is, now squeeze your toes. Very good for the arthritis. You know, people suffer from gout. The first symptom they get usually is the big toe is inflamed. Very painful. This is a problem with the uric acid, too much uric acid in the body. And they get then gouty arthritis. Do all the rest of the toes also, up and down. Squeeze with a big toe, like this. Squeeze. Here you are squeezing at your own power. But if you have got very gentle bones, please be careful. Be gentle. Then you take your feet up and down, coming up, breathe in, going down, breathe out. Breathe in and hold. Hold here. Very good for my ankle joint and the rest of the feet. Down, up, down, up, hold. What else is happening? And the calf muscle also, you are getting that. So you are activating your calf muscles, and that will help us for the lymphatic system, because the pump is here for the lymphatic system, as heart is for circulation. This is one of the pump there. Now you can join with love and affection and go on rotating clockwise, anti-clockwise. Very good. You are doing very well. Very good. Now other one is, which is very good for your knee joint also. Sit at the front part of your chair. Don't have a fall. Do like this. The heel is touching the ground. Heel is touching the ground. Breathe in. Hold it. Hold. See how much pressure is coming here. Plus on your knee. We are all suffering from knee problem. Some of us already got knee replacement. Then take it back. Back as far you can go. Breathe in. Touch. Touch and hold. Don't do in a rush. I'm not going to cover everything. No. Go back. Go back as far you can go. Don't get any pain in your knee. If discomfort starts, hold there. Then again, you have done this. Now other one. Heel. So much stretch is coming. Very good. Then take it back as far under the chair. Again, front, hold, hold. Back, again in front, back. Now, if you can manage with both the feet, do it. Otherwise, don't worry. It depends how bad are your knees and the ankle. Now, just imagine a paper is underneath your foot. You are just pulling that paper. That's what they teach you in orthopedic department. Just, this is very good for the knee joint. Just, you are bringing that paper which is underneath your feet, forward and backward. See, simple. Then you can do like this, or the butterfly at the same time with the arms going. Yes. Then you can join your soul when we join our soul like this is a Vaqarasana, which is very good. Same benefit as butterfly, Vaqarasana. You're joining your feet, not moving your knees at all. Sit for short time. Very good. And good for the pelvic floor also. For the prostate, the uterine prolapse, bladder prolapse. Now next one, as we all do this. This is very good for varicose veins, getting rid of pain, pins and needles, increasing the circulation in the whole lower limb. Okay. Then the next one, you do your own massaging. Rub it nicely. Always put some soft cream or oil in front and back. And do these channels, which are 4 channels in between your small bones of the foot. Again, this is, from the neck, face and the neck, and the back is represented opposite side. Opposite side. Yeah, this point I want to make clear. From here, and the back is opposite side. When we do acupressure, that works like that. But from here onward, it is in the front, same side. So here, I am doing my right foot. I am suffering from sciatica or knee pain, hip pain, ankle pain. I'm doing these channels. There are 4 channels in between these small bones. Do it quite, you have to do hard, to get rid of those problems. I'm doing my right side, so the problem is on my left side, lower limb. Then you squeeze nicely. Do every toe. Every toe is important. Every toe. Good massage. And then with the knuckle, you can do acupressure. The same points as on the palm, there on the sole. You can do with a pencil or maybe electric gadget also. So you've done that. Now rotate your ankle clockwise, anti-clockwise. Then hold your knee close to your chest if you can, if there's no backache. Otherwise, sit straight. Squeeze your abdominal muscles to activate the pancreas, the liver, the gallbladder, the intestine, kidneys, adrenal. And then take it down, push it down. You can do again and again. If you're very flexible, bring your nose close to your knee. Hold it. Maybe 10 seconds. Maybe 30 seconds if the time allows. Maybe 1 minute even. As Swami is saying, every pose should be done for 10 minutes. But in classes, this is not possible. Other one, same thing. You are doing your channels to get to the problem on the right lower limb. I'm getting a lot of sciatica, hip pain, knee pain, ankle pain, pain. Good massage. Then acupressure with the knuckles. Just go on doing the whole soul. You will get hold of some of the areas. Your eyes, your ears, your lungs, your pancreas, your kidneys, your bladder, your intestines. Then rotate. Very good. Clockwise, anti-clockwise. Bring the knee close to the chest, squeeze your stomach, get rid of gas also. Too much gas. Then down. The other one we do rotate our hips with a laughter yoga. Left to the right also. Very good for the hip joint. Very good. Not so many people going for hip replacement. Carry on. Well done. Try to relax now. You are done very well. I try to cover some of the things. There are plenty to be done more. Time doesn't permit. Yeah. Yes. Now let's concentrate now on our pranayama, which is very, very important. Even the vata problem, they say, pranayama is better than exercises. These are experts talking, you know. That's what I'm listening. Pranayama is very, very important for all the diseases, any disease, anywhere. As I say, from the head to the toe, from the skin to internal sides, you know, whatever you are having. Even there are so many diseases which the doctors don't know today. People are getting better. But again, I will come back to that point later on, which is very, very significant. Yoga is very simple. Life is yoga and yoga is life. Yes? Now start, we have done Bhadrika quite a lot, but we'll just start as we are covering the steps. Start with the Bhadrika Pranayama. Hands are in. Dhyan Mudra. Dhyan Mudra. Go on breathing from the nostril at your own pace. 2.5 seconds in and out, the same duration. Or as we are doing pranayama for a long time, you can increase the duration 5 seconds, 7 seconds, even some can do for 10 seconds. Breathing in and breathing out. So do that at your own pace. Lift up your spine. And the full concentration is on your breath. Me and my breath. Nothing else. That will make your mind very, very stable. You can go on chanting also any mantra, any dhun. Yes, carry on.
Mama yoga anakwenda sawa sawa, hakuna matata. वस्तु अमोलिक मेरे सतगुरु वस्तु अमोलिक मेरे सतगुरु कृपा कर अपनायो पायो जीवन कृपा कर अपनायो पायो
जी मैंने राम रतन धन पायो पायो जी मैंने राम रतन धन पायो जन्म जन्म की खोजी पाई जन्म जन्म की खोजी पाई जग में सभी खवानो पायो जी मैंने जग में सभी खवायो पायो जी मैंने राम रतन धन पायो पायो जी मैंने राम रतन धन पायो
Please raise your arms up, rub your palms. Already you are well activated. I know that. Put your palms on your eyes. Feel the warmth going on your face. Slowly open your eyes. Remove the hand. Give massage on your face at the lower eyelids to get rid of black patches, which is quite common, and swelling over the lower eyelid. The lateral angle very gently over the upper eyelid, very gently at the eyebrows. This is all increasing the circulation in the eye muscles to get rid of any problem with the eye. Watery eye, discharge eye, painful eye, red eyes, or the vision is getting better. Then the temple region, to take away the stress. Temporal artery is there, which is creating a lot of problem in some people. Very serious problem. Prevention of that, not to get problem. Over the head, come down, behind your ears, the index and the middle finger, just pull it down to your throat, the parathyroid, thyroid area, parathyroid is behind, so take your finger behind the four lobes, in front of your vocal cords and the thyroid gland. We want to activate and increase your nitric oxide. We all know that you people now expert on that, listening to our friend the last so many months. Now we are doing acupressure points on the ear, start from the top. This is very important. Whole body is there. Any problem, cough and cold, sinusitis, bronchitis, asthma, dizziness, hearing problem, which is so common. Upper part, the middle part, and the lower lobule. Ear lobule is very important. This is connected to our brain also. We do not super brain yoga. That's what we are pulling down, isn't it? Hold it at the top. Do it clockwise, anti-clockwise. Every part of ear has got one of the organs of the body. Clockwise, anti-clockwise. Now coming to our, again, golden age. People are suffering from dementia, depression, anxiety. And the children are suffering from autism. No concentration. And then ADHD, that is where learning problems come with those conditions. So this super yoga is very, very important now. Now, by the way, this type of thing they were doing for the thousands of years. especially the people in the south, when they stand in front of Lord Shiva, they do this. Hold it like this, and then breathe in, breathe out, go down. Now do your Kichi Mudra also. Kichi Mudra will give extra benefits. So do Kichi Mudra, breathe in, then you go down. While sitting on the chair, we are doing. Head is going down. Then coming up, exhale and cut up. And you do at your own pace. At home, you can do maybe 10 times, 20 times. Again, breathing and breathing out, keeping in mind with the Kichi Mudra. This is going to increase the circulation in the brain, activating both the hemisphere. And other thing is, with the Kichi Mudra, you are getting the benefit of that, activating your master gland pituitary, getting nectar from there, and good for meditation also, and the nervous problems, even for blood pressure. Parasympathetic is activated. Cooling down. Carry on. The sweating we are doing, what is happening there? You're doing a lot of sweating when you want production of nitric oxide. What else is happening? When we are sweating, we are activating our 2 chakras down below. The Mool chakra, that is root chakra, and the next one is Swadhisthana chakra. They are also activating. So that's why they say this is very, very important, Everything is coming from India, I think. These people are doing for 1,000 years, and now we have realized the benefit. Now they called it Super Brain Yoga. It is originated from India. People are doing this when they're going down in front of deities, And we're looking at some friends, they do this Shastang Danvat. That is one of your poses in Surya Namaskar, isn't it? So much activation is happening. So whatever we are doing, there is something. Other thing which I am observing now in the temples, some of the ladies, when they come in front of our Hanumanji, they stand like this. Am I right? So let's see where the action is occurring. They do like this, and then they do like this. See? They're getting the benefit on the upper arm, shoulder, because one of our poses known as Yoga Mudra Asana is like that, which I'll do in a minute. So you've done your Bhadraka Pranayama. And next we move over to our Kapalbhati. Now Kapalbhati is very beneficial pranayama, as we all know. But again, here, precautions are very, very important. Hypertensive heart problems, severe acidity, severe asthma, severe backache, or you are suffering from chronic bleeding. Like example is epistaxis, the nose bleeding. You have to be careful. Those first I mentioned, you can do slowly, but here, if you are suffering from chronic bleeding or epilepsy or headache, migraine even, please don't do Kapalbhati. This is very, very recently a case has happened. Headache is very, very important. One should know the cause why the headache is occurring. There's so many diseases which are giving us headache. We normally think vision problem, high blood pressure. No. There's other things also. So, chronic breathing, epilepsy, stroke, high blood pressure, and headache, please don't do Kapalbhati. So, hands are in any mudra. You all know all the mudras. I will start with my Prana Mudra. Breathing out from the nostril, the full attention is on exhaling and go according to your body, either slow speed or medium. Power is used. The stroke is 1 stroke, 1 second. And make sure the whole abdomen is moving. The upper part, middle and the lower. You can put one hand underneath the nostril to check if your technique is good. If you're feeling the warm air coming on your palm, and put another hand on your abdomen to make sure the whole abdomen is moving. The full attention is on breathing out. We are breathing in automatically. Now, this again we have to do with full concentration. Take the mind to the problem you are suffering. The thyroid problem, take your mind there, even put your hand there. Both the sides. That call it touch healing also. That's what we do in Reiki, you know. Thymus problem. Pancreas, here. And request the pancreas to give me more insulin. I want to get better. I want to get rid of this diabetes. The liver problem on the right hand side. The spleen. The whole intestine, starting from your stomach, duodenum, small intestine, large intestine, down, going to your sigmoid colon, rectum, and anus. Just think of that, those areas. If you are suffering from piles, take your mind to that area, at the anus. And then come kidneys behind, adrenal at the top. So let's say I don't know where my organs are. What do? Put your hand on your Manipur chakra. That will cover everything. At the umbilicus. Area is umbilicus, Nabhi area. I don't know where my liver is. What can I do? The solar plexus. Okay, my friend, you do like this and then take your hands down also. If you've got problem reproductive system, activate the fallopian tubes, the ovaries, the uterus, cervix, and in the man, prostate. And the testes. People are getting pregnant after 20 years of infertility. How? Because of the yoga, with the blessing of our Swami Ji Ramdev Ji Maharaj. The next one, time is very tight, so I will just do now how we do our asanas. 5 asanas are more than enough. While doing Kapalbhati, well, it's not for everyone. If your body allows you, do Kapalbhati with them. Otherwise, just do Kapalbhati or the asanas. Just asana. The first one is Mandukasana. Thumb in, make fist, put it like this at the navel. Breathe in and breathe out and come down straight. If there's a neck ache, don't come like this, just stay straight, erect. Now here you can do Kapalbhati. To get the full benefit, as Swamiji says, every pose should be done for 10 minutes. People are getting better from diabetes. This is one pose. The second one is hand on the left hand on the navel, right at the top. Here you can control your abdomen much better. Breathe in, breathe out, squeeze in hard and come down. Do Kapalbhati. Very good for the pancreas. Some part of the gut, some part of the liver, and the spleen. But the major effect is on pancreas. And don't forget about while doing Kapalbhati. Any major surgery, 4 to 6 months. Even for minor surgery, you don't do for a couple of weeks and then you start doing on the instruction of your physician or the yoga teacher. When we are pregnant, we don't do it. Kapalbhati. Menstruation, we don't do it. Everybody knows now these precautions. You are all expert now. Then breathe in and come up. Now, if you want to activate more, you've got problem with your liver. Fatty liver is so common. If we go for the test, more than 60% will be diagnosed fatty liver. Hepatitis, liver cirrhosis is so common now. So they say put your right hand first and then the left. Breathe in, breathe out, squeeze it and come down slowly. And go and doing Kapalbhati. With a smile on the face and full attention is on the organ. Visualize and feel. That is important. Then breathe in, come up. Next one is Shachakasana. Hand on the knees, breathe in, take your arms up and do Kapalbhati. Look straight, take your arms down and again start the Shachakasana. Breathe in, stretch, go down. You can manage to Kapalbhati, do it, otherwise don't do it. We call it baby pose also now, this one. Then breathe in and come up. Stretch your arms, look at the ceiling. Bring your arms by the side, slowly. Next one is Vaqarasana. Bend your right knee. Stretch out the left one. Bend the right knee. Stretch out the left one. Now put your right hand like this here. And then I am looking on the left hand is behind, looking over my left shoulder, as far behind I can see. Here my left leg is also stretched out. The other side. This is doing like this, looking over my right side. The right, behind. And change over. The left leg is bent now, right is stretched out. I'm holding my left knee at the side and looking over the left shoulder. Now let's say your joints are not that good, then you can do like this. How far you can go. See, say my hips are pretty bad, but I want to do some exercise. I can do like this also. So, same thing. So you do according to your own body. You can create your own, which is not giving you any discomfort. You follow your body. Same thing here. I can't bend it, I can't bend. So I do like this. Very good. The next one is cow's pose. The right knee on the left in a line. Take your right arm up, very close to the ear. Sit straight. Right leg is on the left. Right arm, take it like this, very close to the ear, behind, touching the back part of my head, not like this, like this. On the jura, we have got jura there. Trying to touch both the hands. And you can look up if you wish, if there is no neck problem. If there's a neck problem, don't look up, just sit straight, facing straight. You can do Kapalbhati with this also. Release. Other way around. Again, close to the ear, going behind, touching both the hands. Can't touch, I can do my acting. But sometimes they say, get hold of a handkerchief and try to touch the ends of the handkerchief. You can look up, then look straight and release. The next one is Yoga Mudrasana. This is best done in Padmasana, but as my body doesn't allow me, so we do sitting on the chair very easily. Same thing again, second pose of Mandukasana. Left hand at the navel, right at the top. Breathe in, breathe out fully. Go down towards the ground very slowly. Watch your body. Now here again we are imagining we are touching the ground with our chin. I think it's a little bit difficult to do Kapalbhati in this pose. Some of you may be able to do it. This is very good. Increasing the circulation in my brain also. Not to suffer from depression, Alzheimer, dementia, memory loss, loss of concentration. And for my hair also, this is good for the hair growth. Then you breathe in, come up very, very slowly. Now, to make it more strong, sit in the little front of the chair, be careful. Hold your hand at the back. Breathe in, breathe out fully. Go down slowly, slowly, slowly. Imagine again you're touching the ground with your chin. Hey, hold your arms up. Hold your arms up. See how much pressure is coming from the thighs to your abdominal organs. So you're getting all the benefit. Hold it tight. Up as far. Good for your shoulder also. Not to suffer from frozen shoulder. Then you come down slowly and release yourself. Now, according to the teaching of our Guru, these 5 asanas are more than enough with the pranayama. If we do this, we increase our immunity to get ready to fight against any invader, bacteria, viruses, or fungus even. Fungus is giving a lot of problem. So this was your Kapalbhati with poses. The next one is Puja Pranayama, which is very, very important with the multiple benefits. Anti-snoring, anti-aging. Take away all the snoring and clears our voice, make it more harmonious. Good for heart and lungs, get rid of asthma even. The weight balancing, activating of thyroid gland, parathyroid gland, the vocal cords. So very simple to do it. I put my hand, you can put in any mudra. I do Vayu Mudra because I suffer from water problem. Joint pains and Jatharagni is disappearing, digestive problem. Squeeze your neck muscle, sit straight, relax yourself first. Squeeze your neck muscles, breathe in from the nostril, do your Khichdi Mudra also. That is very, very important. For the thyroid gland, parathyroid gland, activation occurs with that also. Plus activating your master gland. Do Khichdi Mudra, breathe in from the nostril, the sound will come from the vocal cords which are constricted like a snoring sound. Go on breathing, you can't breathe anymore, then hold your breath, bring your chin close to the chest. If there's no neck ache, hold as long as you feel comfortable. Again, precaution here is, if you're hypertensive or heart patient, please don't hold your breath. Can't hold anymore. Straighten your chin, look straight. Close your right nostril with the right thumb. Exhale from the left. So let's do it. Khichdi Mudra. You all know this, so I'm moving on now fast. Alom Vilom, which is very, very important. Balancing ourselves completely. Teaches us how to eat, how to talk, what to wear, and how to behave with others. Balancing the whole. Ahar, vihar, vyavhar. Cooling us completely. Close your right nostril with the right thumb and get rid of all the problems. Production of good hormones, the serotonin, endorphin, oxytocin, the loving hormone. And get rid of any type of headache. Any type of headache. Good for the vision, good for the kidneys, not to get nephropathy. People are suffering, you know, with nephropathy, landing into dialysis. Balancing of all the electrolytes, minerals. Get rid of extra fluid from the body. Sleeping better, get rid of insomnia, anxiety, depression, all the emotional problems. Fear, anger, greed, and other nervous system problems. MS, multiple sclerosis, Parkinsonism, paralysis. People are getting better who are practicing this Anulom Vilom. They are getting such speedy recovery. We have got one example in our class. 7 days she recovered from the left side paralysis. 7 days. Speech got better. So many examples. Carry on with full devotion. What we are doing is Surya Vedi, Pranayam and Chandra Vedi. Right side is your Surya Vedi, connecting to the left brain, and the left side is Chandra Vedi, connecting to that. But here we are not holding our breath. That is the difference between Nadi Shodhan and this one. In Alom Vilom, we are going on alternate breathing. But when we do Nadi Shodhan, which is very, very important for autoimmune diseases, there are so many. They are adding up every day more and more. Over there we hold, we do that. Maybe next session I can demonstrate if Sharonji allows me. So we are doing simple alternate breathing, which is very effective. Keep your neck straight, mind straight. Think positive. I love to sing, but the time doesn't allow, I think. I'll just sing 2 lines, you carry on with your work. Alom Vilom. You carry on. I will go on singing. मुझे लागी योग संग प्रीत, मुझे लागी योग संग प्रीत, दुनिया क्या जाने मोहे लागी योग संग प्रीत, दुनिया क्या जाने कोई क्या जाने कोई क्या जाने, मुझे लागी योग संग प्रीत, दुनिया क्या जाने, मुझे लागी या योग संग प्रीत, दुनिया क्या जाने, योग करो और योग की कराओ, योग करो और योग कराओ, जीवन अपना सफल बनाओ, जीवन अपना सफल बनाओ, ओ मोह लागी योग संग प्रीत, दुनिया क्या जाने, योग यात्रा में सब आए, योग यात्रा में हम सब आए, गंगा जल सा ये है भक्तों, गंगा जल सा ये है भक्तों, मिलके डुबिए लगाए, हम मिलके डुबिए लगाए, योग प्रतिदिन करें हम मिलके डुबिए लगाए, योग हम रोज करें, योग करें और योग कराएं, योग करें और योग कराएं, मन वांछित फल हम पाएं, मन वांछित फल हम सब पाएं, मोह लागी योग संग प्रीत, दुनिया क्या जाने, मोह लागी मोहे लागी योग संग प्रीत दुनिया क्या जाने. Well done. Next is our humming 3 times to increase again nitric oxide. Get rid of insomnia. Mahamri Pranayam 3 times, same benefits, insomnia, good for heart and lungs. Get rid of all the sinus problems. Udgit Pranayam 3 times. Hands are in Dhyan Mudra. Lift up your spine. We do 3 times chanting of Om. 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 The 8th step known as Prana Pranayama. Prana means supreme power. Om. Om. Hands are in Dhyan Mudra. Silent meditation. And we are in the state of gratitude also. Hands are in Dhyan Mudra. Fix your mind either on your breath or the third eye. Go on chanting inside any dhun, any shabad, or think of divine, the cosmic power. I am never alone. The supreme power is always with me because मैं उसका अंश हूँ. माँ में वन जीव भूते जीव भूत सनातना. मैं उसी ईश्वर का अंश हूँ. He is always with me. And we are thankful to Almighty who gave us strength to perform today's yoga. Thank you. Thank you. Thank you. Raise your arms up. Rub your palms. Put the palm on your eyes. Slowly open your eyes and move the hand. Sing asana, very important for the whole face, sinusitis, for the voice, and anti-snoring also. 3 times we'll do. Massage your throat, swallow the saliva. Hasyasana. Well done. Well done. Life is too short. Life is too short.
Yeah.
Live in the present. Live in the present. Past is dead. Past is dead. Past is dead. Don't worry about future. The next second, who knows? Very good, 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 very good. Thank you very much. Now, closing prayer. Sarve bhavantu sukhina, sarve santu niramaya, sarve bhadrani pashantu, ma kashtit dukh bhag bhave. Be everybody healthy, wealthy, enjoy prosperity. None should suffer. Om Purnamida Purnamidam Purnyat Purnamudachyate Purnasya Purnamadaye Purnamevavashishyate. Hari Om Tat Sat. Hari Om Tat Sat. Hari Om Tat Sat. Om Shanti Shanti Shanti. Thank you very much, everybody.
Thank you, Dr. Kapur. That was excellent. We have thoroughly enjoyed. I'm sure we all had a good time. You can mute yourself and you can say anything you want to speak. I'll close the video.